Some children might be overly sensitive to touch, or might be very interested in certain types of motions. So we've had children, toddlers, who can spin pretty much anything from their shoe, plate, lid, pencil, anything. Some children also have develop interest in unusual activities or unusual objects. In this case, we have a little toddler who likes cans and likes to scan cans. We are also at this age just beginning to see the emergence of unusual motor behaviors and hand mannerisms. But these behaviors in this group usually are not very pronounced, do not have to be very pronounced in the second year of life. Now, autism is not only about deficits, but also about some excesses, and you might have heard that some children with autism have actually quite exceptional abilities. This phenomenon was for the first time described by Dr. John Langton Down, who noticed that some children with very profound developmental delays might have a specific ability in a one isolated area. And this ability might have to do with exceptional memory, musical skills, artistic skills, computational ability, and it's usually isolated from all other skills. Here I pulled a drawing by Stephen Wiltshire, who has unbelievable visual memory skills and drawing skills. Here he's drawing, I think it's a panorama of Tokyo, after a very brief flight over the city. I would encourage you to go to his website and actually see a few videos of how these drawings are produced. When we think about toddlers, we don't really see a lot of exceptional abilities, although some of our toddlers are very interested in learning about letters, numbers. Some begin to sight read. They can recognize signs, stops, exits, find them everywhere, read them out loud. Those who are verbal might have a very good expressive vocabulary. They might like to label objects. They might have actually quite extensive vocabulary for their age. And some of the toddlers we see have great memory for movies or books, and they can recite them verbatim. Presence of these kind of skills often might delay a diagnosis, because parents of an 18-month-old who is interested in their ABCs and can recognize all the letters of the alphabet, parents of a child like that might overlook the fact that the same child might not be interested in interacting with other people, and might not be using functionally on any of the language skills he or she has. Nonetheless, we see these skills in some children, not all children with autism. They tend to be isolated, not integrated with social interaction or more sophisticated play. They tend to be repetitive. Children who like letters will gravitate toward letters. They will not play with dolls. And in many kids, they are transient. They do not develop in special interest on unusual abilities. I think in my clinical practice, I've seen only a few children who went on to develop special skills. One of them was a little boy who I saw maybe at 20 months, who really loved shapes. He could label any shape, show him any shapes. He would see a table as a rectangle. Almost every object was reduced to a shape, which then he could label. It turns out that by the age of 5 or 6, he stopped being interested in shapes, but he developed interest in train schedules and routes of the metro system. So what do we do with all this information? We know we have an idea what autism might look like in the second year of life, and then a child presents in a clinic for a differential diagnosis, and what do we do? How do we go about it? Well, rule number one is we step very, very lightly. It's a very serious disorder. It's diagnosing a child with autism it's highly consequential for the life of this child and the family. And for that reason, we take this diagnostic process extremely seriously. Each child is seen in our clinic for 2-day evaluation. We bring on board 3, 4, sometimes more disciplines in order to better understand the child's clinical presentation and be able to sort out what might be driving the difficulties we see. Here I'm listing for your information an example of a battery of tests we would employ for an 18-month-old baby. As you can see, a large portion of it involves interviewing parents, taking very detailed medical developmental history, understanding whether there were any factors in the child's development which might potentially account for the difficulties we are seeing. We interview parents using divine and adaptive behavior scales to understand better what is the child's presentation at home. We can take a snapshot of the child's presentation in the clinic, but we want to understand how the parents perceive a child at home. What are the skills that the child demonstrates in the optimal environment? We also usually have 2 or 3 clinicians interacting with the child. The reason is we want to introduce different people to the child because each of us brings a different style, and we want to understand whether the observations we see are consistent across contexts, or maybe they are context specific. Maybe one of us had something very special that we were or not able to elicit from the child. In order to diagnose a child with such severe developmental disorder, we need to understand the child's developmental functioning in verbal and nonverbal domains, again to see whether there might be any factors which contribute to the child's social difficulties. We study their nonverbal communication very carefully, and also subject the child to a play session, semi-structured play session, which helps us evaluate the child's spontaneous level of social interaction and communication. Only when we have all these bits and pieces of information, we can get together with all the clinicians and begin to discuss what the diagnosis might be. Also, at the end of this process, we have a lot of information about the child, and not only important for diagnostic purposes, but also important for treatment planning for a given child. As I mentioned, diagnosis is a very serious issue at this age, and when we started running this clinic, we were asking the same question: how stable this diagnosis is. If we see a child at 18 months, 20 months, the child's presentation is consistent with the diagnosis of autism, how likely it is that this child will still present as a child with autism 5 years later. And we conducted a couple of studies here at the clinic, and it appears that the stability of the diagnosis between 2 and 4 is relatively high. And our colleagues in other centers also report a similar findings, which is quite encouraging, which means that we actually can predict to some extent diagnostic status of these children. However, there's a huge variability. Children move a lot within the spectrum. I just wanted to mention to you a study which is just